move on to our next speaker, and it's my pleasure to welcome Svitlana Surodina, who is CEO and founder of Skein, but also a researcher here in our Department of Informatics at King's and ARK Entrepreneur in Residence. So handing over to Svitlana and my co-organizer for today. So if you use this.
Thank you so much, Richard. Really appreciate the organization of the event. It's never easy.
You want to find your presentation, which
it's
is
a PDF. No, sorry, PDF. The one below.
This one.
Yeah.
Okay. Can we make that large? Which is the button to make it big? Maybe just like that for now.
Yeah, thank you, Richard, for sorting out my slides. I will just start by thanking Davide, who gave an amazing overview of the set of technologies that he's working on, and I think it's absolutely exciting what he and his team does. And I guess building on what he was saying about the distributed data technologies that we can all in the future hopefully utilize to make our nation healthier and wealthier, I would like to take a look at the concept of value of data today, and hopefully at the end of the talk I will be able to demonstrate you some of the ideas for data evaluations that you potentially can use in your work. And this thing doesn't seem to be working. Okay.
I think it's because it's a PDF rather than
right. Okay. Right. So looking from the perspective of data value, of course, we all know that data is hugely valuable. Throughout this week, there were multiple estimates of what healthy longevity actually worth to society. There were like numbers 60 billion for each extra year of longevity, and then the UK versus the rest of the world. So this number is pretty random, to be honest. That's a 5-year longer, healthier lives in the UK. That's what it could cost to our society. But let's be honest, these big numbers don't really resonate with us as people who work on health, how really impact society in a way, how it can improve its life expectancy, because we really all distributed and we all work as organizations separately, and we think a little bit different about those numbers. But of course, whenever we talk about the value of data, it's really hard to overestimate, because of course, with data, we can have better prediction and diagnostic of diseases. We can provide personalization of many treatments, start treating rare diseases, which is a significant part of ill health, and of course, help us to discover new treatments, new medicines, much faster, more efficient. So the problem remains, value of data needs to be measured so we can manage that more effectively. But what is value of data? It's very much context dependent. Health data, what is it? It's very heterogeneous. So it's the air we breathe and food we eat and supermarket shopping patterns, and of course, hospital data. So it's really hard to define that concept. And there are multiple use cases. Some of them I've outlined here, but of course, there are many more of emergent use cases. It's about how we incentivize data sharing. As Davide was talking about, in the marketplace, can we put a value on a data set so it actually can be traded and be useful in various application contexts? It's about regulatory compliance. How can we demonstrate that the data we collect is of sufficient quality and relevancy and actually doesn't contain any bias that will lead to wrong decisions by AI? We need to use the value of data to understand those kind of metrics and be able to report on them. It's even things like environmental impact of businesses on health of employees and society, something that was also discussed this week. It's also all needs to be measured, but of course the most complicated part of it is the fact that the data is distributed. It's not Google holding data sets on all of us and can really put the numbers. It's really the fact that it's the most value comes when we bring together all those dispersed data sets. And as Davide was saying, of course, it's a huge problem infrastructurally because of data privacy, which health data specifically very vulnerable to any kind of leaks and disclosures. So, of course, we need to resolve that, keeping in mind there are all these different use cases. And if we could solve that, we would be able to progress significantly in our health improvement efforts. So from the perspective of our company, our mantra is building the future. What does it mean in practical terms? We believe that in order for us to build anything usable and useful, we need to anticipate any meta and macro trends that are happening right now in the society, and then build up that backwards in any of the technologies we develop. And in particular, so what we're really trying to anticipate right now is changes in regulatory requirements for AI fairness, for example, meaning how well the data is how well data represents the global populations. And then when this data goes into AI algorithm, we know that it actually doesn't discriminate me because the data was trained on some other subsets. We also need to comply with various regulations that don't even exist. Again, David, before me, mentioned that there's some rules and regulations that are coming up and they will be more active, but now we kind of just have a glimpse how it could look like. Another problem is, of course, that we go into the next phase of our technology development. We start thinking about remote health. Of course, we know all that COVID really highlighted this challenge, that we ideally need to make sure that we can be in real time, worldwide represented to reach the furthest, remotest area of the Earth to ensure equality and fairness in distribution of those technological achievements. And also things like real-time full sense holograms, real-time surgery is something that probably still kind of in infancy, but we should expect that in a few years' time that should and could be reality. And of course, climate impact of data transmission is a huge thing. We need to really be thinking carefully. Whenever we say that, oh, we're just going to drop anything on blockchain and David, I'm not I'm not talking the blockchain implementation for tracking access rights, for example, but there are some ideas of cryptocurrencies will solve everything. We just need better encryption mechanism, which will consume more energy. That's, we believe, a wrong way of thinking about it. We have to think about implications, how our data is collected, stored, transferred from one place to another. That's a really important part that we have to consider in our technology designs. And the way how we approach that and what we suggest that we all have to start thinking in one form or another is how we can value the data within all those use cases and considering all those limitations and future opportunities. And we propose a distributed data valuation tool that is based on decision support system for non-technical executive. Why this non-technical executive point is very important, as again, coming back to David's talk, it's tremendously difficult for systems that are technology complicated to be easily understood by decision makers within organizations who are usually more often than not are not really specialists in distributed ledger technology or federated learning of anything of that sort. So whenever we think about valuation tool, it's a decision support for executives, for those decision makers who will decide whether a certain system is implemented, whether data is shared, where certain technology is applied. And here, yeah, it's just an example of some of the solutions for technical decision makers in distributed data valuation platforms. And of course, no one can understand that. I don't know what it means. But when we translate that into a decision support system that's adjusted for the needs and real world application, then we can actually benefit from implementing them. So that's a quick schema of the system that we're working on. It's essentially a federated learning solution which has a centralized machine learning model adjusted for different use cases. And essentially that allows us to maintain privacy, but at the same time, making sure that we can compare our local data with a centralized model and make assumptions and draw conclusions on the difference that our local data has from the centralized, meaning that we can say, if our data is lower quality or higher quality, how much it can contribute to the running of centralized machine learning. We can use a executive-friendly interface to understand that difference, understand that value of our local data in comparison to all those data holders without disclosing any data sets, without actually transferring them or copying, not in anonymized, not even in any form, but just really relying on the comparison of outputs of two local models. Of course, there's encryption of parameters. Of course, there's privacy and security layers, infrastructures that have to be in place, but at the same time, we follow the principle that we just use the result of the model, not actually any direct data comparison. And this type of comparison could, model comparison can generate a lot of insights for understanding how valuable our data is in comparison to all the other marketplace participants or organizational participants. And so this pretty straightforward in terms of approach, but as we know, of course, the real complexities and real validation has to happen in real world. And as I mentioned, things like, for example, transmission, the challenges of network infrastructures really pronounced. We cannot show that this organization is actually many hundred kilometers away from all the others, and that the data transmission has to happen on this part of the schema, that we have to take that into account when we plan our network and our data transmissions. Similarly, of course, the heterogeneity of data that I mentioned. So it's very important that we validate all those assumptions that we're working on and test and implement in real life scenarios. So I'm just going to quickly show a few projects where we're developing technologies and testing technologies for this infrastructure. So one is European Union sponsored project where we work with hospitals and research institutions on designing a system that helps people with migraine to manage, track, and treat their condition better. There's quite a few very salient characteristics of this project. So, for example, it's women who are mostly affected. It's a very complex conditions with multiple factors. So, meaning that we have to integrate all these various types of data sets, including sensor data collections with temperature, oxygen saturation, and everything else from a device that underneath patient's skin. But it's also very important that we collect user-generated data, something that used to be journals in paper. People would enter their symptoms and then just trying to figure out, okay, maybe that what triggered my condition. And that's real. That's how migraine is being treated right now. So what we need to ensure here as part of other challenges is that all the various hospitals participating in the schema and all the individual users are able to contribute their data and able to be incentivized. They have to be incentivized to more accurately track any information that they could contribute to better understanding of their condition. So that's one of the practical, real world set of challenges I would say we are solving as part of the system. And yeah, David covered very well some of the problems that real world projects encounter. So that's something we did a couple of years as a seed work, I would say, into the technology development that we're working on right now. And we work with the University of Oxford to develop this really exciting architecture that we thought it was really interesting. So we published a few papers, and it was all very great. But the biggest problem for us as a technical company was not to develop the solution, but actually explain decision makers at Oxford what it actually does. And they're like, no, it's too complicated. You have to like tell our professors in public health how it works. And we found it tremendously difficult. And we found that our technology, actually technological solution, is really hard to scale up to the next level unless we have this sort of interface between people who do technology and people who sign off papers. And that's a bigger part of the problem. So that's a second project we're working right now, and coming back to the opportunities of the future where we can leverage the high capacity communication networks for a better health. So for example, comprehensive monitoring of mental health, remote surgeries, holographic presence, which of course can bring all these amazing opportunities for remote doctor checkups and to the furthest parts of the world. Currently, our networks are not really developed for that. 5G wouldn't allow us to do a holographic representation. So we need to start thinking, okay, what's the next step? We are participating in this project where similarly looking at all the data providers and data transmission points that have access to the signal data, to the local distribution data information, so we can aggregate that all together, engage them into this data sharing and analytics, and help us to build better intelligent-driven data and transmission networks on a transport layer as well. And below the checkbox, actually, that shows that we essentially infrastructurally have solved as a society, solved most of the problems around deep learning methods and processing data, infrastructures and tools, but capabilities of communication networks are really lagging right now. And I'm just finishing with highlighting the King's research that we are conducting here at Human-Centered Computing Research Group, looking at visualizing data heterogeneity in federated learning, meaning that we solving the problem of organizational behavior and decision making from the lens of what information we need to communicate as data value to our enterprise level decision makers, so we can enable more efficient heterogeneous data sharing and affiliation for health. Thank you very much. Just last slide summarizes our contribution, but yeah, I'm happy to answer any questions that you may have. Thank you.
Thank you very much, Svitlana. Are there any questions in the room? Maybe if I can stop sharing first. Here we go. Questions in the room or online?
I'm interested in this challenge that you've got. Oh, sorry. Hi. A brilliant presentation. It's great work that you're doing. I'm interested in this communicating with people who don't understand the technology, and there's this huge gap between the researchers, the people who know the content, and the people who need that access. This sort of work with that. On Monday we heard about the work health index that the CBI are creating. Is that something that could feed into this to help organisations to improve the way that they're working with the health of their staff?
Interesting you're asking, because our project was one of the case studies that of parliamentary groups on longevity, and specifically we looked at the application of the social responsibility reporting, right, such as impact on health of employees and health of the consumers, where it's essentially the same principle. We're just taking the measures and data points on this change within organization, for example, but we don't want to disclose that data set to any kind of external regulatory or assessment entity. We want to compare our performance in regards to other organizations, but in the way that we don't have disclose anything.
So it keeps the anonymity, but gives them the information they need to make the overall changes. Brilliant.
Yeah,
Thank you.
Thank you.
Any other questions in the room or online? Maybe I could ask a question. You mentioned about individuals collecting their data in your migraine app. What do you think about the concept of citizen science and collecting, again, consumer community data? We saw a good example throughout COVID with the Zoe app. How do you think that would integrate into some of the concepts you're proposing?
This is one of my favorite questions, and that's the app we're collecting the data from. And you can see here probably it has like a big orange button. I have a migraine now, and then it's pulsing. So, which is really easy. People who are living with chronic pain condition are actually very nice type of people to engage with, because they're very actively driven to participate. So, you know, when I have a migraine, or I probably headache rather, you know, that's my number one priority. That's what I would press anytime, you know, and I don't have to be incentivized in any way. But then when we talk about people who are healthy, and that's what we're really trying to solve, right? We want healthy people to stay healthy, not treat sick people. It becomes much more difficult to make them contribute the data and to be diligent and filling in forms and pressing those buttons. So I think that's one of the biggest challenges for us. How do we incentivize those people to participate? And I think this question of incentivizing them kind of instantaneously translates into, okay, what is my value that I provide to the system for data collection? And once we're able to put value on the data we collect and compensate in the appropriate way, not necessarily money. I don't think money actually is a really good way of incentivizing people. But if we can first value and then design an incentive system to engage those people more, that's essentially the algorithm of the solution.
Great, thank you, Svitlana. I mean, with the Zoe app that was developed here at King's with Tim Spector, because of the COVID environment, everyone was really keen to enter their symptoms, and that actually informed the policymakers real time. So we can see value in that data to inform the stakeholder, who was the government at the time, and we had a stricter lockdown perhaps because of it. Because of time, we'll move on, but thank you again, Svitlana. So it's my pleasure now